So Janet is here this morning because she had an operation on her left hand for arthritis about 5-6 weeks ago. Um, Tell me about your initial consultations with me. What do you think was good? What did we try and do before we went for surgery?
Well, I thought the consultations went well. You explained everything to me, that good and bad, the worst case scenario and the best thing. So no, I was very pleased with it, and you tested it all. I did all the X-rays and things. No, I was very pleased with it. I felt I knew something about what was happening to me.
And of course, Janet had problems with both of her thumbs. In fact, she's undergone the surgery to the right thumb. There was a combination of arthritis and tendonitis. And we tried initially some hand therapy and a steroid injection. How did you find that? Was that beneficial? Did it only last for a few weeks? What made you then decide to have the surgery, which we obviously try and avoid in most people?
I felt that the cortisone injections or the steroid injections really had little effect, maybe for a day or two. The hand therapy again, very slightly beneficial, but it got to the point when really neither of them worked and I had to go for surgery.
And what was your experience like coming to hospital here, having the surgery?
I've got nothing but praise for the staff, albeit admin, theatre staff, yourself. They made me feel very comfortable and reassured me. I've got to say, hand on heart, I didn't have any problems. For the hospital experience, which can be daunting, and certainly as you get older, I wouldn't have any qualms coming back. Please God, I don't need to, but no, I have no qualms. Everything was chickadee-boo, for want of a better expression.
Okay, great. And now Janet also had, although it's quite a big operation on the hand, which normally requires the patient to be asleep, we were fortunate anaugh to have an anaesthetist who was able to numb the whole arm. How did you find that?
Brilliant.
Being awake?
Brilliant. It was, yeah, I can't complain. It was a wonderful experience, and I've got to say I had a hoot one way and another. And if it wasn't, it was surgery, you'd say you had a good afternoon out. The injection was absolutely fine. It didn't cause me any problems, and of course there's no recovery period for it really.
That's right.
Out the theatre, quick check over and back to your room for something to eat and drink. So you get no after effects. I'd recommend regional block.
Okay, great. And with regards to your right hand, because you've obviously had the same operation done and we'll be taking off the cast in a few minutes. With your right hand, what's better, and just remind us how many months ago it was, and what's better about it, and what problems you still have with your hand?
It was October. I had it done in 2015. I would say it's 85% back to full pain-free. I get an odd twinge now and then. The numbness I experienced in my thumb is gradually gone, and it's just very, very slightly. But I've got full movement, just occasionally. But it comes with getting old. You can't expect, and you told me you can't expect 100%. You hope for 100%. You don't expect it. What this is at the moment, if this one turns out the same, I can live with the pain because it's very minimal. So it's been worth having done.
Great. Well, thanks very much for that.